my keys, so she's on her way. She'll be here in just a second. You've been working hard, man.
Yeah.
That's awesome. David Didden. I'm a family physician. I grew up in Shepherdstown, and I have a solo family practice here in Shepherdstown, and I've been a physician for 20 years. We see the effects of extractive industries across the globe. We see the effects of income and wealth disparity, education disparity, green space disparity. And the people who are going to be adversely affected by the development of this factory in Jefferson County are already marginalized, living in some of the poorest parts of the county, if not the poorest. There's so much uncertainty, I believe, in the actual outcomes that are being discussed about this plant that we need to really step back and question the necessity for this plant. Formaldehyde, benzene, phenol. So these, I'm not a toxicologist, but I can tell you from a family medicine perspective that there's enough evidence that these chemicals individually, when children and adults are exposed to them, can be very problematic and cause respiratory problems like asthma, cancers, mutations in DNA, things like that. Those are from the studies that are done based on the chemicals as individual exposures to community members. What's not studied very robustly is the additive effects, the interactive effects of putting all these chemicals together in an exposure on top of the chemicals that exist residually in the environment in that part of the county, left over from decades of pesticide use on the orchard. When you take that exposure and then you place the exposure into one of the most vulnerable parts of the county where people are already experiencing high rates of poverty, very challenging home situations, lots of trauma, adverse childhood experiences, difficulty in schools, you're further exacerbating the disparity in health, in social determinants of health, and we need to pause. We need to really stop this before it goes any further and really evaluate what's happening from a population health perspective. We have to move out of considering these policies and proposals from an individual basis and look at it from a population health basis. I think when you step back, if you're really paying attention and you look at the net effects of a plant like a rock mineral wool production facility, I can't imagine being in favor of it when you consider the overall effects. It's very disturbing. Again, at the local level, I'm also very concerned about the emission of fine particulate matter into the atmosphere and the children and families being exposed in the neighborhood adjacent to the plant are already at high risk of health complications. They already have high rates of smoking, high rates of adverse childhood experiences and trauma, high rates of chronic disease compared to the rest of the wealthier parts of the county. So we have to be aware that one additional exposure, such as breathing in polluted air, could be the tipping point that pushes our local health system, which is already short on primary care clinicians, into an emergency state where we're without even basic resources to be able to meet the healthcare needs of these patients, further overwhelming our emergency system, or emergency departments, causing unnecessary exposure to medical testing and treatments that could be prevented. But if we stress the system too much by adding this additional environmental exposure that's toxic, we could find that it takes what was a marginally functioning system and makes it, basically dysfunctional. The families, the children, and individuals that I've worked with through outreach into local social service agencies that provide basic, food, shelter, clothing, are so stretched. They are so close to either homelessness or malnutrition, violence, substance abuse, chronic disease, that adding an additional stress, such as daily toxic exposure to things like formaldehyde and phenol, particulate matter that they're breathing in, it seems criminal to me. It seems so selfish and so inappropriate. These folks are struggling just to get by every day, to deal with a healthcare system that isn't built to meet their needs already. We don't have access to enough good primary care to meet the needs of the people already. So if we start to see an increase in birth defects, an increase in children, infants and children with special healthcare needs, who have to, see a pediatric specialist, say a neurologist, because we're restricted through the state Medicaid system, they have to go 3 hours to Morgantown to get their health care. And 3 to 4 months out of the year, it's hit or miss whether they're going to be able to make it over the mountain. So no one's looking out for their needs at the policy level. Everyone is stretched so thinly, trying to scratch together a system for them that many people are already falling through the cracks. And when you need more physicians and you need to recruit clinicians to your community, to be able to fill in some of those gaps, to be progressive, to be innovative in healthcare delivery, to look at things like population health and value-based care that leadership across the world and the country recognize is the model to move towards. And you put up a factory billowing toxic fumes and particulate matter into the atmosphere 24 hours a day, 7 days a week. How is that going to look when you drive them, around looking for housing? How's it going to look to a young physician coming out of residency? I understand that it can be enticing to consider 150 jobs as a huge benefit for a community. But I think it's misleading to take that figure in isolation and assume that it's an absolute positive. Step back and look at the broader impact that developing those jobs is going to have on the community, on the health of the population. Look at the costs that come with those jobs, and look at who's going to get those jobs. I work closely with people who really need work in Jefferson County. They're struggling with substance misuse, they're struggling with housing, they're struggling with chronic diseases because they don't have access to healthy food choices or medical literacy to be able to navigate the food system and the healthcare system. These folks are not going to step into factory jobs ready to go. So I have a sense that a number of those jobs are going to come from outside of Jefferson County, the people to fill those jobs. I also think that when you look at the overall impact of having a plant like this that is a heavy polluter, that the drain on the economy, the reduction in quality of life for the region as a whole is going to lead to significantly more than 150 lost jobs downstream. So looking at employment as a major social determinant of health, I think you even lose that argument because of the negative downstream effects of changing the nature of Jefferson County dramatically. And finally, I think that again, we have a major opportunity here to build on the community mobilization that has come from this proposal. I am optimistic that in a year, 2 year, 5 years down the road, we are going to be looking at this as a watershed moment for Jefferson County that consolidated people across political spectrum, across economic divisions, that coalesced us into engagement and involvement, and that will lead to us becoming more proactive in recruiting good stewardship for the environment through appropriate industry, right? We want to help people find work and to improve the economic well-being overall for this community and for the region. We need to develop partnerships. We need to connect the people who are marginalized due to very poor social determinants of health, and people with economic resources, provide the training and provide the opportunities for those folks to further their education and training and get solid work. But that's not going to happen when we're making people sick. We have to make them healthy, and we have to make the community healthy.